Hi everyone! Hi, nice to see you all. I think it is morning in Australia for all of you down under. I'm on the east coast of the US and I'm here to hang out with you guys today. So I'm Angie Alt. I'm a nutritional therapy consultant and certified health coach. I run the website Autoimmune Paleo as well as the Autoimmune Wellness podcast with my partner Mickey Truscott. I also work one-on-one with clients through the Paleo Mom Consulting. I run a highly successful online group health coaching program called SAD to AIP in 6. I'm the author of the Alternative Autoimmune Cookbook and the co-author of the Autoimmune Wellness Handbook. I wrote that with Mickey this year. And this year I also helped conduct the first ever medical study of the AIP diet with Dr. Gauri Konajeti at Scripps Clinic in San Diego, California, on the effects of AIP for those with Crohn's disease and ulcerative colitis. So it's been a very busy year. I'm here in collaboration with the Nutritional Therapy Association of Australia to tell you about me and my work as a nutritional therapy consultant. So pop your questions in and I'll try to answer those. I have a few things to talk about along the way. I'll tell you a little bit about my health story and my work as a nutritional therapist. Hopefully I don't talk too fast and I do okay. I also wrote notes for myself that are over here because honestly I will get a little bit like discombobulated if I don't have my notes. So if you see me glancing over, I'm just trying to remember where I'm at with everything. So I'll start with my health story. My story begins shortly after the birth of my daughter when I was 21. 75% of those with autoimmune disease are women, and the main reason for this is our complex hormonal systems. It's not uncommon for women to experience onset of autoimmune diseases around puberty, after giving birth, at menopause, and that was certainly my case. After I gave birth to my daughter, I started to have some changes to my skin and the first symptoms of what was diagnosed as lichen sclerosus a few months later. Lichen sclerosus is an autoimmune disease that affects mainly the genitals of women, sometimes also men. At the time when I was diagnosed with lichen sclerosus, I thought that it was kind of crazy. I didn't know what was happening exactly, and there wasn't much of a culture of Dr. Google at that time. So I actually looked up my symptoms in a medical encyclopedia. Back in the way back we used those. And then I went to my doctor and I said, I think I have this. And he did an exam and he said, yes, you're correct, you do have this disease. And he gave me a steroid cream and sent me on my way. And what he didn't say was this disease is an autoimmune disease. And that was like a pretty important piece of information because I might have been then on the lookout for the possibility that I would develop more. Autoimmune diseases left untreated often kind of trickle into more diseases developing. So I just kind of stumbled along from there, trying to, do my best with a steroid cream and move on. But then I started having other symptoms. I started to have some changes in my bowel habits, and I went and saw my doctor again a few months later. And I got the first of many misdiagnoses at that time for what would eventually be celiac disease. I was told that I had irritable bowel syndrome. Something like, I don't know, a crazy percentage of celiacs are first misdiagnosed with IBS. So that definitely happened to me. And they told me not to worry, that, IBS wasn't that serious and just don't worry about it. And so I continued trying to kind of cope. I was raising my daughter and I was busy as a young mom. And then in my late 20s, my husband and I tried for another child, and we soon found ourselves on a journey with infertility. We went through all these different tests over the course of several months, and in the end we were told, they couldn't really find a reason for our infertility. Sometimes it just happens, and that we should start IVF. They were very, really pushing us to start IVF. if we wanted to conceive another child, and they told us that it was probably because of my age. At the time I was 28, so I was really astounded that my fertility was so terrible already at 28 years old. And we really suspected that there was something more. We had a really strong gut feeling that something else could be wrong. I remember my husband even asking the doctor, could there be something more wrong with my wife's health? We're really concerned. And they said, oh, no, you just need to start IVF. But we really held off. During that same time period, my husband was transferred overseas to West Africa for his work in international development. So we moved to West Africa, and I got all kinds of crazy vaccines so that I could go live in the developing world. And we moved into this environment where I was exposed to all kinds of new bacteria and viruses, and my immune system was working very hard. And it was also an extremely rewarding but stressful environment. The developing world is really challenging. And within a few months, I was in the depths of autoimmune disease. I didn't really understand that yet, but I was really deep in it. In September of 2009, I had my first medical evacuation while living in Guinea, West Africa. Unfortunately, it was on the same day as a very serious political upheaval in the country, and we evacuated to a neighboring country for what they suspected was appendicitis. It turned out that it was not appendicitis. It was my second autoimmune disease, endometriosis. I eventually returned to the United States and was diagnosed after following laparoscopic surgery with endometriosis. Endometriosis is kind of one of those diseases on the long list of autoimmune diseases that is there as a potential autoimmune disease. The research isn't quite strong enough yet, but it's suspected. And I kind of approach endometriosis and managing it as though it is an autoimmune disease. Having 3 autoimmune diseases in total, I can tell you that endometriosis is suspiciously like the others in some ways. So that was my second diagnosis along the route. And I thought, okay, good. Now my endometriosis has been treated, and I know about this other disease, and it was well under control, and I can return to West Africa, and everything will be fine. Well, I did return. By that point, we were living in a country called Sierra Leone, and I started having new problems and new symptoms. This was probably, now in hindsight, I realize a result of my small intestine being damaged from celiac disease being untreated. The more your small intestine is damaged, the less you are able to absorb nutrients, and then you start to have a cascade of other problems. For those of you who are already nutritional therapy practitioners or consultants, or those of you who are getting ready to study with the NTA, you're going to learn all about this. So, I started having nerve problems. I started having a lot of emotional and mental health issues. We don't really associate those issues as being so dependent on our vitamins and minerals from our food, but it's really a big player. My hair was falling out, I was losing weight, I was losing muscle mass. I started having a lot of strange muscle cramping and pain, a lot of bone pain. I had insomnia, I was waking up in cold sweats every night, I was running a low-grade fever. Eventually I started slurring my words and having fine motor skill problems. So for instance, if I dropped a pen on the floor after 6 or 7 tries, I could not pick up the pen and keep writing. So this, the brain fog was very bad, it was really mounting, and I was in this environment in the developing world where it's really hard to get adequate health care because, the health system is so kind of excruciatingly unable to meet the needs. So I had a second medical evacuation. This time I went by myself because the first evacuation was so stressful for our family that I decided to do it on my own to try to spare my husband and daughter some of the stress. So I evacuated to a neighboring country with what they thought was a blood clot. I was treated with blood thinners, and it did not turn out to be a blood clot. It just turned out to be undiagnosed celiac disease, working its way through my body. So after that, I went home to the United States again and started looking for help, seeing a lot of doctors. Most of them told me that I was just anxious and depressed because I was living in such a challenging environment in West Africa and that I should just take some antidepressants. And I knew that wasn't what was wrong. I knew that there was something physically wrong, but I couldn't really get help. So I once again returned to West Africa to be with my family. And in October of 2011, I went through my last medical evacuation. This time I was evacuated to the Tropical Diseases Hospital in Brussels, Belgium, because they suspected that I had cerebral malaria. I spent 4 days in the hospital in Brussels on IVs, being rehydrated, and them trying to bring my condition under control. And every morning the nurse brought me a bowl of soup thickened with flour, and I couldn't understand why I didn't get better, but it was celiac disease. When I returned home to the United States from there, at this point I said to my husband, I cannot return to Africa. I have to go home and figure out what's wrong. I have to see, as many doctors as I can until I get an answer. And I just started earnestly seeing doctor after doctor. Probably in the end, before getting diagnosis, I saw probably about 25 different doctors. One of those doctors that I was referred to was a psychiatrist, and I also saw a psychologist. And, I was having such severe panic attacks, anxiety problems at this point that they misdiagnosed me with PTSD. And we started to talk about the possibility that I would admit myself for a short stay in a psychiatric facility because it was getting unmanageable at that point. And they were really pressing me to take antidepressants and anti-anxiety medications. But I knew something physical was wrong and that I needed to find that underlier. My primary care doctor at the time told me to eat all the pasta, pizza, and ice cream I could to gain weight. He told me I was losing weight because I was too anxious. And I was like, yes, I am too anxious because something is wrong and I need help. So finally, he agreed to send me to a gastroenterology specialist, a GI doctor, and I saw her, and she suspected celiac disease and tested my blood antibodies and also did an endoscopy, taking biopsy of tissue from my small intestine. And finally, about 11 years after the onset of my first symptoms, I was diagnosed in February of 2012 with celiac disease. My primary diagnosis was kind of there all along underneath, feeding into all these other problems. So that was a breakthrough moment for me. I started the gluten-free diet, and unfortunately the traditional, conventional gluten-free diet wasn't enough for me to heal in that debilitated state. I had spent a lot of years by that point malnourished, and it just wasn't enough. In fact, my antibodies climbed, and I started ending up in the emergency room with anaphylactic style reactions to other foods. This was just more evidence that my small intestine was very damaged. So I started looking for answers. By this time, Dr. Google was alive and well, and I was doing all this research, and I came across the first threads of the autoimmune protocol that Dr. Sarah Ballantyne was researching. And I started the autoimmune protocol in May of 2012, and within 6 weeks, my antibodies dropped by half. In 6 months, it was like I had a new body, and it was clear that it was helping more than my celiac disease. My other autoimmune conditions were also getting better. And by a year, I changed every aspect of my life to support wellness, including changing my career, and at that point, working my way to where I am now. So that was kind of my health journey. I hope that wasn't too crazy long, and you guys were like, oh my gosh, this is insane. I can't believe she's still talking about it. How did I find the NTA, the Nutritional Therapy Association? Well, I found NTA through Mickey Trescott, my partner at Autoimmune Paleo. I had already been certified as a health coach and been working in my health coaching practice for a few years, but I had known from day one of my coaching education that I wanted to go much deeper in nutrition, and I wanted to be able to, enhance my education to help my clients even more. And through learning about Mickey's experience with the NTA, I knew that it was the right next step for me in my continuing education. Anita says, your story sounds so much like mine. This is like deja vu. I lived in East Africa, though. It's incredible that so many celiacs are misdiagnosed. Why do you think this is? So, that is really crazy. Like, we have the East Africa, West Africa version of this. I think one reason that celiac disease is so misdiagnosed is that doctors are kind of trained that, first of all, that it's a very uncommon disease, and second of all, that the primary symptoms of the disease are diarrhea and weight loss. And I think that many people, like something like 50% of celiacs, present with symptoms outside of the GI system. So things like what I was going through, mental and emotional trouble, peripheral nerve problems, things, that you wouldn't maybe first glance associate as being related to the digestive system. Now, we nutritional therapists wouldn't look at it that way. We would know that foundationally something is probably up. But I think that's one reason, Anita. So that's how I found the NTA, through Mickey. My experience with the program, honestly, was super intense. I won't sugarcoat it for you guys. It is an excellent education with fantastic teachers and a really eye-opening training, but it can feel like drinking from a fire hose. I have to be honest, for myself, I was already running my own business, and I was writing the Autoimmune Wellness Handbook with Mickey at the time that I was going through the program, so my experience was probably a little too heavily stacked. But again, with all of that said, what I learned at NTA was invaluable. I absolutely adore my education there. Jessica says, thanks so much for sharing your story. Incredible. Thanks for listening to it, Jessica. I know it's kind of long and really crazy. When I went through my NTA training, I attended the Long Island, New York venue in the US, and I graduated in the 2016 NTC class. But they have venues all over the United States and Canada, and now Australia, which is so awesome. You guys can find out about the program and the venues that are offered at nutritionaltherapy.com or at ntaaustralia.com.au. As far as what the NTA has meant for my personal health, the program meant that I was able to more concretely connect the dots between what was happening, what I was observing happening with my body and symptom changes, and foundationally how I could correct a given problem. And it's also, I was already a pretty empowered autoimmune patient. By the time you get into like an 11-year journey looking for a diagnosis, you start to get pretty empowered. But I can speak very knowledgeably with my doctors now, and that really helps me be a great advocate for myself. The NTA gave me that foundation. Natalie asks, I heard you had also taken the IIN course. Can you speak to the differences or similarities? So IIN, Natalie is referring to the Institute for Integrative Nutrition. So my original certification as a health coach came through IIN's program. And I would say that a great thing about IIN is that it gave me an accessible platform to launch my career and get started. It kind of allowed me to dip my toes and get kind of a broad overview about the process of working with clients on wellness goals. But it wasn't very in-depth. NTA is extremely in-depth. Like I said, it's a pretty intense program, honestly. And it really helped me have foundational knowledge that took things so much further. I think that the two programs can be a great combination, and if I could go back and do it all over again, I would do NTA first and focus on that foundational knowledge first, and then add some of the, maybe health coaching bits. But, if you're struggling to choose which program to do, I would definitely start with NTA, and then you can decide from there whether or not you want to continue your education in other ways. I think that concrete nutritional information, especially from a real foods, whole foods perspective, is really unique and extremely valuable with NTA. So another area to talk about is, how did NTA impact my career since I had already started as a health coach? NTA added so much depth, as I was saying, that I can offer my clients. I think it took me from being a health coach to a health educator. I can help my clients understand the why behind an approach with so much more confidence, because I intimately understand now the play between their diets and what is happening in the different body processes. It's empowering to know it, and it's awesome to be able to teach it. As far as whether or not you need to be in the health industry to study with NTA, Anita's asking about this. You don't. You definitely don't have to already be working in the health industry. They're going to cover all the bases for you and then kind of gradually lead you into the more complex areas of nutrition. That said, the coursework is definitely challenging. I wouldn't call it difficult, but it is challenging. And, just remember that nothing worth doing is easy. So, keep that in mind as you work through the program. One of the questions that I got earlier was whether or not, I have any new projects underway or coming up. Mickey and I are always moving and shaking. Mickey's like an idea machine. It's kind of crazy. But right now, our new projects are top secret, so I can't reveal to you guys quite yet. Anita asked, what's the best case study or outcome to a client's problem that you've experienced? So this is kind of a hard question because there's been a lot of really, really amazing outcomes and awesome things that I've gotten to, be privileged enough to watch happen. But one that stands out in my mind is that a few years ago in my group program, I had a woman join who was struggling with infertility, something that's, it's very close to my heart because I went through that myself. And a year later, she contacted me and said, after, working through the process and following, the path that I had laid out, she had given birth to a baby girl. That was really amazing. It made me cry. And this year, getting to participate in the medical study with Dr. Konajetti at Scripps in San Diego was amazing. Getting to see baseline information and then coming out the other side and getting to see the changes that it made in people's health so concretely was really amazing. I have to be honest that the first time I saw some of the results, I cried. It's very rewarding. Let's see, what else here? As far as, maybe like, those are kind of some inspiring cases. As far as what's kind of the most rewarding part of being a nutritional therapy consultant and a health coach, for me personally, I'm very invested in helping push the whole wellness revolution forward. I'm really interested in this large scale thing. And, I honestly believe that we can change the world. I know that probably that sounds a little hokey and some of you are like, yeah, but no, I really think we have a shot at this. And on that large scale, when I see signs that the shift is happening, that's what's really rewarding to me in this career. An example is when I started my group programs, many members would join saying that they were there in spite of their doctors. Their doctors didn't believe that this could help and that they were just doing it because they were trying anything to help themselves. Now, about 3 years later, when members join, a lot of them are there because their doctors told them, go start this diet, go, eat real whole foods, find a way to do this. And that is amazing to see that shift is happening in real time. That's very rewarding. Let's see, there's some questions here. Somebody asked, who was your instructor and what were they like? So when I was in the Nutritional Therapy Association program, my instructors were Caroline Behringer and Suzanne Mondello. Caroline is honestly the bubbliest, kindest person you will ever meet. She's just so sweet and so bubbly, and just always has just such positive energy. But she is also smart as a whip. And it was like really a privilege to get to learn from her. And Suzanne too, she's just so well spoken and very supportive. When I was going through the program, I was at a very busy time in my professional life and they were both really supportive to me, and it was great to have them behind me. I didn't get to have direct contact with John Jennis as an instructor, but he was instructing through some of the videos, and then later I had the chance to meet him at the Nutritional Therapy's annual conference. And he, again, just like incredible knowledge. The stuff that they were sharing was just, it was so awesome to learn from people like that have been practicing for so long and just, have just really know their stuff. Let's see. Kathy asked, does the NTA program include how to promote your business? They do work on some of that stuff. That kind of comes towards the end of the program, and they give you some information about how to dig into that. And the steps you need to take to set things up. I really appreciated some of the resources, even though I already had my business going by the time I was in the program. Some of the resources they put forward were really great, very helpful. Natalie wants to know, what was your workshop weekend like? It was a lot of work. We were, when you go through the program as a nutritional therapy consultant, you have one long workshop weekend where you just basically work all day long for a whole weekend, learning all kinds of information and working in real time right there physically with your instructors and group leaders. And it was great. It was great to meet my classmates. It was great to learn all that information and get advice from other folks who worked in various other areas and were bringing nutritional therapy into their lives. It was a lot of fun. It was tiring. It was like really tiring. Your brain is like really working, but it was good. It was really good. Let's see. Natalie also asked, how do you work with a client whose doctor might not be on board with nutrition as a solution to their autoimmune disease? How do you create a relationship with their primary care physician? So usually this is one of the first things that I usually ask clients when we start working together. I ask them about the kind of healthcare team they have around them and whether or not those people are supportive of the steps that they can take in their own life to try to improve their wellness. And, I kind of get a gauge for that right away. And then what I do is try to start working with my client to be able to have effective conversations with their providers and try to make that collaborative. And if the provider is open and willing to be collaborative and we can kind of get that conversation going, then, what I can do is provide information to my client to help them make the most of that time, that 15-minute window usually that you get with your doctor in an appointment, really helping them facilitate that conversation. Once in a while we're lucky enough to have doctors that are, ready to collaborate directly with me, and I'm always happy to do that when that comes up. Let's see. We're answering some of the questions. Let's see. One question that was given to me was, most of us grow up learning about health and nutrition either via our parents or the conventional paradigm. An example of this might be how many people grew up thinking you have to eat low fat to be heart healthy. Did NTA give you any major light bulb moments about nutrition and health that were a surprise to you? So I was already pretty immersed in the kind of information that NTA teaches when I came to the program. So I think in some ways I was kind of lucky that I'd already had a chance to kind of start absorbing those ideas. The shock and awe aspect of learning about real nutrition had kind of passed for me already. But what did happen was this sense of how miraculous it is. It really reinforced to me that that sense of appreciation and wonder at what my body and all bodies can do if you give them the right fuel, if you feed yourself the right food, what your body can do. Learning the intricacies of how that worked was, it made me feel like, this is a miracle. So, let's see. Blair asked, just coming in, sorry if I missed this, what do you recommend a person do to prepare for their business while in the classes or before? Some say blog, networking, your thoughts. So, Blair, I think it's super important to start to get your social media presence out there. Starting a blog and starting to write about the niche that you're hoping to serve, and Networking, definitely starting to get to know other kinds of practitioners, and seeing how people are working together. That, for instance, my partner Mickey and I, that's how we met. We were out there blogging together and started talking and became friends, and eventually working together on our business. But all of that said, it is important. It is definitely starting to build that presence is important. All that said, being internet famous is kind of like being Monopoly rich. It's useful, but you need to have that strong foundational knowledge so that what you can offer is solid. So don't let the kind of overwhelm of building that presence get in the way of pursuing your NTA education. Jennifer says, do they teach you how to work with clients? What evaluation tools do they teach you to work with clients? So Jennifer, there's 2 certification tracks, 2 different programs with the Nutritional Therapy Association. There's the Nutritional Therapy Practitioner, which my partner Mickey Truscott is, and the Nutritional Therapy Consultant, which is my certification. The main difference is that Nutritional Therapy Practitioners, NTPs, get training in hands-on evaluation techniques. So this will teach you how to actually physically touch your client and discover what's going on and what how they're responding to supplements and other things like that. And then with a consultant, this certification doesn't do the hands-on evaluation, and the reason I did that training is because I primarily work virtually. I work with clients all over the world and through a group program, so I didn't need to have the hands-on training, the physical touch training, but they still do teach you how to evaluate and work with a client. Primarily they teach you through using a nutritional assessment and looking at signs and symptoms to help your client. Mackenzie said, hi Angie, how much time do you spend every week on homework, and what was the most challenging part of the curriculum? Whew. Mackenzie, I am not sure. I would say that you probably need a minimum of 20 hours a week for homework. The reading in particular is a pretty demanding list. If you can get started on your reading list early, that would be best. That'll allow you to kind of get through that reading material a little more manageably. And it's just, it's not that the material is super hard and you won't be able to learn it. You will be able to learn it, but it is challenging material, and it's the kind of stuff that you need time to kind of let it soak in, kind of steep in your brain a little bit. So I would give you at least, give yourself at least that much time. As far as the most challenging part of the curriculum, again, I think it's probably the reading. There's a lot of really in-depth reading. It's great reading. You will love reading it. I don't think that there's a book that they had us read that I didn't find a lot of value in, but there's a lot of it, so you need to be prepared for that. Jennifer asked, do you recommend any books or resources for AIP? If you want the Autoimmune Protocol Bible, I would recommend The Paleo Approach by Dr. Sarah Ballantyne. That's like the super detailed science if you're into that. If you want to know how to kind of put it into play, that's my book and Mickey's book, the Autoimmune Wellness Handbook. If you're looking for great starter recipes for the elimination portion of the diet, I would consider my partner's book, the Autoimmune Paleo Cookbook. That's Mickey's book. Jennifer also asks, are you planning on going to the NTA annual conference? Yes, I am. Mickey and I will be speaking there again this year, and we'd love to see everybody. So let's see. We kind of talked about instructors. Let's see. Oh, one of the questions was, have you ever been a group leader, and can you share with everyone what group leaders are? So group leaders are former students who come back to help new students through the course. They offer insight, give feedback, etc. They can kind of help out with any questions, or as you're working through homework and book reviews, things like that, if the instructors need some additional help. They're there online, and they're also at your workshop weekends, and it also gives them a chance to review the material themselves. So I've never been a group leader, but I would definitely love to be one at some point, because I would love a chance to look over that work again and get to help in teaching other people the coursework. I think one of the best ways to solidify information for yourself is to teach it to others. So that would be awesome. Blair asks, best way to start gaining clientele. Where do you start? Blair, I think the way you start is you just kind of start putting feelers out there into your community, the niche you're hoping to help, and seeing if there are folks that are willing to work with you. During NTA, you take on practice clients, and this gives you an opportunity to kind of put your skills to practice and hopefully come out with some positive experiences that you can start to share with others. As other people recognize that you're doing great work, they'll be interested in working with you as well. Word of mouth can actually be very effective in the beginning. I think, those are kind of the main ways that I worked in the beginning. In the very, very beginning, when I was still just working as a health coach before my NTA training, I worked with 3 clients initially for free. And at the end, they gave me, feedback and testimonials that I could share with the public. And when people begin to see that, I could actually help a client gain positive results, that gave me some traction to gain more clientele. Anita asks, what was your community project when you studied? So, Anita, my community project was a presentation at the annual conference last year. So originally I had this big, crazy idea of this ebook that I was going to do for my community project, but I was also already writing the Autoimmune Wellness Handbook with Mickey, and we were getting ready to present about the autoimmune wellness path at the conference. And I was like, oh my gosh, how am I going to get this all done? So I sat down and I talked with Caroline and Suzanne, and I said, ladies, I am not sure what to do. I want to get this all done. I'd love, I just love all this stuff, but I think I'm in over my head. And they were like, I think that your talk that you're going to give at the conference is a great community project. So that was my community project. We talked about the 7 key steps to wellness on the autoimmune path. Let's see. Natalie says, can you build a career from what you learned from the course? Can I start a practice or do something else with my certification right after I graduate? Yes, you definitely can build a career. There's definitely room for this. On Mickey and I's website, autoimmune-paleo.com, we have a very detailed blog post. It's called, if you Google IIN versus NTA, you'll find it, and we compare the Institute for Integrative Nutrition's Certified Health Coaching Program to the Nutritional Therapy Association's program, but we also go in depth about the possibility for a career that exists out there doing this work. There is a very big need. Our world, unfortunately, is quite ill, and people who can help others foundationally start to change things and help empower people to make diet and lifestyle changes that can, bring back their health. It's needed in so many different ways. Not just, I primarily focus on autoimmune disease because that's my personal background, but, there's a need for this kind of work with the elderly. There's a need for this kind of work with women, especially mothers. There's a need for this kind of work with children. There's even a need for this kind of work with men. Sometimes men's health gets kind of a little bit relegated and overlooked, but there's so many niches that you could work in. There's definitely a possibility for a career here. And yeah, you can start a practice. You can consider working with other healthcare providers. Maybe you'll work under an MD who wants a nutritionist in his office. Maybe you'll work with a chiropractor who wants similar help in his office. Some people work under consulting companies. For instance, Mickey and I both work for the Paleo Mom Consulting. That's where we take on our one-on-one clients. So you may not have to start your own standalone practice necessarily. And there are lots of other things you can do. Mickey and I write books. We blog and try to get all this free information out there for folks so that they can, make these changes. I run the group program, SAD to AIP in 6. I know a woman who took her personal training background and combined it with her nutritional therapy certification, and it now runs a program for those working on their fitness with autoimmune disease. So there's just all kinds of ways to take the next step after you get your certification. So I think if we have a few more questions, I'll hang around for a little bit longer and see if anybody has questions that they want to share. Otherwise, maybe we'll start to close up here. Hopefully I didn't talk too fast for you guys, and hopefully I shared good information that was concrete and you could understand. Oh, okay, Natalie's asking, what is your favorite blog or podcast? So, obviously I like my own blog, Autoimmune Paleo. But I also really love the Paleo Mom's blog because she just has such great science. She has a background in biomedical research, so it's just such great science. I also really like Chris Kresser's website. He also is an obsessive researcher, so the information is just really solid there, and I like that. In the past, I've listened to Chris's podcast quite a bit. A lot of knowledge is dropped in that podcast, so that is one that I would check out. Jasmine asks, I'd love to write a book. What are the steps to take? Okay, Jasmine, spoiler alert, but you should maybe come to the conference this year because Mickey and I are going to be talking all about this for folks. We know that a lot of people are really curious about this. Mickey and I both got our original start by self-publishing. So, you know, the step there is to come up with your idea and start to sketch that out and lay it out, and then, you know, start to research the process for self-publishing. I think that self-publishing is an awesome way to get your start if you would like to write a book. Let's see. Oh, and you said you hope to see me at the conference. Yep, I'll be there and giving the information that you wanted to get. All right. If that's about it, I think we'll kind of wrap it up. It was great talking with you guys today. I can't say enough positively about the Nutritional Therapy Association. If you're on the fence and wondering about whether or not this education is for you and whether or not it can lead to a viable career, I am here to tell you that it definitely can. It takes a lot of work. It's not easy, but anything worth doing isn't easy anyway. All right. Thanks so much for being here with me, you guys. Bye.